Hi, friends. Dr. Nancy Trimbley putting the power and knowledge of your health back in your hands. I know some chiropractors that once you've had spinal surgery, they will not touch you. That you made that choice, and if it didn't work out, well, shame on you. I do not feel like that. I actually specialize in people that have previously had spinal surgeries. I'm going to show you an image that I got from an internet search of somebody that's had a lower back spinal fusion. And this is a typical type fusion, what I see now. And I'll share my screen. And this image you're seeing here, this is an image, this is an x-ray of somebody's lower back from the side. That's the one on the right. And on the left, that's from the front of them. So you can see the metal in there, and you can see the screws that are going into the vertebrae. This level is L4 to L5. So this is an L4-5 fusion with hardware. Here's the thing. This is what happens. If you look above the surgery, see that space in between this vertebrae and the one above? That space looks really good, nice and healthy. But you see this space below? You see how there's a little bit of bone spur right there where my cursor is, and a little bit of bone spur there. Now it's very mild. Now here in the back of the vertebrae, there's also a bone spur right there. That dark area right there, that's the nerve canal. That's where the nerve exits from the spinal cord, and these specific nerves go to hips, legs, knees, feet, go to the colon, and work everything pretty much from your belly button down. This is part of the sciatic nerve. So that little bone spur that's in that canal, that might not be a problem today if this person just had surgery. But over time, because the stress of life no longer has 5 vertebrae to spread the stress out over in the lower back, because these two are fused, it only has 3. There's already degeneration. That is called osteoarthritis. There's probably a dozen different words for what's going on there. Osteoarthritis, spondylosis, probably stenosis, degenerative disc disease, degenerative joint disease. There's many different terms thrown around for that. It all means the same thing. There's decrease in the joint space and there's bone spurs. So over time, over the course of years, what will happen is that arthritis below the surgery of that L5 nerve will accelerate. It'll degenerate more quickly than it otherwise would. Now, for a lot of people, their surgery was extremely necessary. They tried every other holistic care they could before surgery. A lot of times they don't, but that's another story for another day. But this is why I work on people that have had surgeries. This is why if you have had surgery on your spine, you need to find a chiropractor, because getting adjusted, and these are gentle, low force, even no force adjustments, help to keep that area above and below the spine mobile, help to slow down the progression of future arthritis, and help keeping those nerves working at their optimum. And it's just because of simple stress of life, sitting, walking, driving, gravity, lifting, just simple stuff. That stress of life will target that already weakened area. And I'll screen share again. And for this person, it is below their surgery site. And I absolutely, definitely will 7 days a week work on this for somebody, because I guarantee you at some point their sciatic pain is going to come back, their foot drop is going to come back, their leg cramps will come back, their digestion will get screwed up. I guarantee it. And the way we work on that, is to do the flexion distraction technique. This I learned from Dr. Paul Markey, who learned it from Dr. Jim Cox, who is right here in Indiana. It's a phenomenal chiropractic technique to reduce the stress and the nerve root compression below a surgery site. If you want to know more about that, check out our technique videos on the YouTube channel. It's on our technique playlist, or check out our website at Trimbley Chiropractic in Cedar Lake, Indiana. Hope that helps. Be well. Bye for now.
Hi, friends. Do you want more? Do you love how I take complex topics and distill them down into their most actionable steps so you can make change today? Do you want more? Come with me, be an insider, be a connected insider in Undercover Vitality, our online community where I share all the secrets. Nothing is held back. Come on, meet me there.